Well, I welcome you to joining just a few moments of some food for thought. I'm a healthcare chaplain and I'm a registered dietitian. So we're going to talk about this third dimension of health. It's the part that most practitioners miss if they focus just on the physiological or the medical needs without taking the whole person in perspective. This sense of the third aspect of health helps persons hold together their efforts to be healthy, to figure out what matters to them. I call this existential needs or spiritual needs, and we've all got them. Some people call these needs religious needs. Some people say they're purely spiritual, but I think we all find meaning and purpose and renewal when we go out in nature, we listen to something beautiful in music, we see beautiful photographs or art, we go out and we go skiing in the powder, we find our flow spot. And if we can help our patients tap into that place for themselves and also to notice what's bothering them, then they can seek better health whole person-wise. We've missed this. So there's been studies for the last 45 years or so and growing steam on this. For instance, a 2024 study by Long et al. Is saying spirituality is a strong social determinant of health. And if we don't address it or bring it into our care, we're missing a huge piece. So they did an interesting study with people diagnosed with cancer. A large study, about 10,000 participants in this study. With a diagnosis of cancer, about 77% of them sought out psychological services. And besides their nurses and doctors, patients sought out two professional groups, registered dietitians and medical social workers for psychological support, much more than they did healthcare chaplains. It might mean because they think chaplains are religious-based, where chaplains are to care for all persons adjusting to illness. So those two patient groups, dietitians and medical social workers, if they don't understand how to address spiritual needs or give spiritual care, there's a huge number of patients that are not going to have their needs met. And what we see is that with unmet spiritual needs, we have much different DNA methylation, shorter telomere links on our DNA, more advanced inflammation markers. So we have worse epithelial linings and glucose management if we have unaddressed grief and spiritual needs. So growing your skills to know how to navigate these kind of conversations is really key. So to be a holistic practitioner, you have to undergo some subjective formation, keying into your own life experiences as you listen and care for patients so that you can see in your conversations where do you follow patients well and give them space, and where do you divert back to information giving? That's a key sign for you that you have some unfinished business. I've written a beautiful book called The Renewed Practitioner, How Spiritual Care Transforms Nutrition, Dietetics, and Lifestyle Medicine. And it goes into each of these detailed aspects of spiritual care, spiritual distress and grief in much more detail, and promotes a training process similar to what chaplains do, but addressing healthcare practitioners' needs. How do we key into our own experiences in life history so that we're available? We want to be able to offer this kind of care. So to protect ourselves too from burnout, we are changed when we listen to people's needs and issues in lives as we care for them. We are changed. And if we don't follow this and address their needs and listen well, we burn out. So it's been interesting. The American Nursing Association said 62% of nurses are experiencing burnout. And those under age 25, 69% are experiencing burnout. The American Medical Association says 45% of MDs and DOs are showing at least one sign of burnout. RDNs show 46 to 57% of them showing burnout. Occupational therapists are a little lower, 40% are burned out. Physical therapists show 45 to 82% of the practitioners are showing burnout. So when we address the spiritual needs of our patients, we also can address our own spiritual needs so that we know how to care for ourselves, how to renew ourselves. So instead of listening for a patient for the data that we need to care for them, when we listen for the third dimension of health, we want to walk into a patient visit and just be curious to be surprised by what they tell us. So we want to listen from that kind of thing. What matters? What is moving to them? How do they renew themselves? What are they troubled about? So one thing that you could do this week is down below, you'll see a link. I'm going to do a new video every week. This week has a spiritual assessment tool that I want you to download and take yourself and start using it as a lens to listen to your patients. So this will give you a keyed up notion of what a spiritual need might look like. It might not look religious right off. So taking the spiritual assessment helps you get started to notice. And then I want you to pick one spiritual practice this week to renew yourself. Maybe you walk outside for 10 minutes without your earbuds in and listen to the birds. You put your earbuds in and listen to some relaxing music, or you slow your breathing down and you're present to the moment. So we're looking for experiences that stimulate gratitude, appreciation, and just more peace. So gratitude, appreciation, and peace are signs that you are living in the flow of your life. These kind of experiences will help you mature and grow spiritually so that you can address this third aspect of health. So come back each week, and I'm going to have a new little video to help us continue to discuss. Please put your comments in the area below, because we'll have a conversation about this. Thanks so much. Bye.